If you dey ever should also just start get some your headache them, or sometimes you need to see fine, or sometimes you just feel dizzy, your eye dey turn, or sometimes your chest dey just hot you some kind of way, so you just feel uneasy for your chest. Come for front, the video now for you. Sometimes you get something where they call and say high blood pressure, or high blood as we call them for pidgin, or tension as Frenchman go call them. If you ever go for hospital, you'll know say the machine, so some machine they so way they ever use them for measure your blood pressure. The machine, the value for up, so they ever measure that pressure for your heart when they don't contract, so they call and say systolic blood pressure. And the one for down, they ever measure the pressure for your bloodstream when your heart don't relax, so they call and say diastolic blood pressure. And the machine so now some very essential thing where all man supposed to get them for their house, for they check their blood pressure then for big 2025. No man not supposed to shoot down for house again without BP machine. If you don't get down, slide for my DM, we'll go arrange your own. Now, the high blood so now some very bad sick because it never ever give symptoms. If you get them for 5-10 years, you never give you no problem. You know ever know something they go on for your skin so until wahala come. Now, you know how when water the waka inside ground, so inside pipe, when pressure for that water don't over high, that pipe the burst, so they release water inside ground, so the water they start come off for road. When they ever say no. Now the same kind of mechanism that way they ever occur inside your bloodstream. When your pressure over high, your blood vessel they not be able for withstand that pressure over time. They go start burst. And when they burst so they happen inside your brain, so they give you something where they call and say stroke. When blood vessel rupture or you burst inside your brain, your blood start bleed out for your brain. They give you something where they call and say stroke, where you know if you're able for waka, you know be able for use your hand or your foot for one side. You ever see that kind of people then so no, they gain a stroke. When it happen for your heart, so they give something where they call and say heart attack or heart failure. And when it happen, especially for your kidneys, so it gives something where they call and say kidney failure again. So you need for no say blood pressure. So now some very important thing we need for take and very serious for your life. Control your blood pressure. Make sure say you know them, because now some sick way they ever happen when person never really anticipate, and if you get them, you don't know unless you measure your blood pressure. You know ever know say you get them.